down. So Dr. Quinn, just explain to us in layman terms, first off, how this is a problem for your patients at times.
This is a big problem for a lot of patients. And the reason it's a big problem is it delays patients getting their medications. Let's hypothetically say you go visit your medical provider and you have a medical condition that's diagnosed and he or she prescribes a certain treatment. Well, sometimes the pharmacy will contact the patient and let them know it was not covered on your insurance and a prior authorization information has been sent to your medical provider. It's the medical provider's responsibility to fill out the paperwork, do the necessary documentation to best ensure that the medicine is covered. And sometimes it's covered, sometimes it's not. But then this is a process that we have to go through.
So what can patients essentially do to help improve that process?
Well, what patients can do to help improve the process is be aware of the fact that the process is because the insurance company wants the patient to receive the treatment, but they want to make sure that they really need the treatment and there are no alternatives out there that are less expensive. Last week we talked about generic medications. Sometimes the insurance company will insist that the patient try the generic first, which we talked about last week, is just as effective and just as safe. But the patient has to be willing to try the generic first in most cases. And then if the generic doesn't work or cause problems, then the prior authorization usually will go through.
So I guess you kind of answered that. When applied for, do prior authorizations in some ways, do they usually get approved though?
Usually they do. If you have a medical provider that's going to do the work, to do all the paperwork, the documentation, but at the end of the day, it's kind of a headache for the patient and the provider. But at the end of the day, we just want the patients to get the medication and get the treatment so they can get better.
All right, Dr. Quinn, thank you so much. If there's one thing that people watching this segment can take away, what would you like that to be?
Just be patient and understand that the prior authorization process is a process where the insurance company, they try to make it so that, the patient is getting the medicine they need, but at a cost that's affordable to the insurance company and to the patient.
All right. Thank you so much, Dr. Quinn. Appreciate your time as always. And at 12:13, everyone, Roberto, tell us what we can expect today.